Good morning again. I'll just repeat, my name is Patrick van der Loo. Welcome. Is it afternoon now? Good afternoon, almost, esteemed members of the press. We're together today really to reflect a little bit on the storied history of Pfizer, but also give you some insight in some of our future breakthroughs that will continue to shape the landscape of healthcare for decades to come. I will not reiterate what I said already earlier and every accomplishment of Pfizer over this 175 years. But again, a short overview for those that maybe didn't hear me when I was in the hallway. So Pfizer was founded in 1849 by two German immigrant cousins, Charles Pfizer, Charles Eckhart, who founded Pfizer in Brooklyn, New York. Still, New York, our continued headquarters to this day. And they started really with the first product, Santonin, which was a breakthrough anti-parasitic. And between then and the Second World War, really the focus has been a lot on antibiotic development and also the development of mass fermentation techniques that were used in the manufacture of specific groundbreaking molecules in that era. As I mentioned before, penicillin, the mass fermentation of penicillin, the mass production that allowed during World War II really was the breakthrough that put Pfizer on the international stage. And in 1950, Pfizer went international. 1950 going international, 1951, first facility on this continent opened in South Africa, very quickly followed by additional facilities that were opened on the sub-Saharan African continent, then North Africa, Egypt, Levant region, and then most recently, 1997, the establishment of our regional headquarters in the UAE, first in the building a couple of streets over, and since 2010 we are in this building. I talked a little bit about the products, the anti-cholesterol medication, the antihypertensives, cancer medication that we have developed, the mRNA vaccine that really the way we view it, saved the world during the pandemic. But it really is the unwavering commitment of all our colleagues during these 175 years that has made me stay with this company for 27 to begin with, but also gives me the confidence when you look forward as an organization. It's 175 years of breakthrough science, but it really is the next steps that really have us really excited about where as an organization we will go next. So, as I mentioned, we've been on the continent for more than 70 years, and we're committed to really our patients for these more than 70 years. When you look at where we started in South Africa and the opening of these, it's not just the medicines that we have brought to this part of the world. It really has been deeply rooted in our mission to bring these breakthroughs to patients' lives, but it's not just the drugs, it's also helping healthcare practitioners and governments in public-private partnerships that really set up countries to better deliver healthcare for their populations and to deliver healthcare innovation. If we look a little deeper in the MERA region, where are we present? And you will see a little bit about our expansive network that will become apparent. We have a very robust team of over 1,700 colleagues across the region, from 38 nationalities, in 5 clusters across the region. And when you look at this, it's roughly 57% female and 43% male in the region. And managing these 75 countries, they're based out of 5 clusters. We have an active presence in around 20, but we service the other 55 countries through these 20 hubs that we have in the region. When you look at it, our manufacturing comes from our global sites, but also from our 3 proprietary regional sites, as well as third-party manufacturing partnerships that we have across the region, as well as a strategic distribution hub that we have in the UAE. So since 2010, we have a strategic distribution hub based in the United Arab Emirates. So when you look at our portfolio, we've been building on our legacy as a scientific leader, investing in enhancing our research and our development capabilities. And this has culminated in Pfizer really developing one of the most robust pipelines in our 175-year history across 6 key therapeutic areas. So vaccines is one, oncology is another, internal medicine, where products like, for example, for migraine, but also cardiovascular disease sit, inflammation and immunology, so products in the field of alopecia areata, for example, We have a hospital business unit that manufactures sterile injectables for use in the hospital setting as well as anti-infectives. And I'm missing one, rare disease, I think very relevant here in the region. When you look, for example, at our investments now in sickle cell disease, right? Sickle cell disease, when I look overall at the burden of sickle cell disease globally, 70 to 80% of the world's sickle cell disease burden is in the Africa, Middle East region. And so to see a company like Pfizer invest in this area where it has the direct benefit for patients on our continent is something that we are very proud of. Now when I look, I mentioned we have a robust pipeline. As of today, and I checked this morning just to make sure that I get the numbers right, as of today, this morning, we have 113 therapeutics and vaccine candidates in development, 45 in phase 1, 28 in phase 2, 37 in phase 3, and 3 in registration. And that changes on a day-to-day basis because products go in, products go out, products get developed through and developed forward in our organization. So more than 100 products currently in development. Now, it's nice to have that big of a portfolio and to have a presence in the region, but I think when we look at our purpose is in bringing these breakthroughs to patients' lives. That's not always as easy as it is in some markets like in Europe or in the US. But we've reached over 45 million patients across all MERA countries with our products in these 6 therapeutic areas. So most of these products that are available in any given country are available here in the region as well. But I would like to highlight another number as well. And I think in a region that has the diversity of disposable income, but also universal healthcare in the region, it's very important that access is not just having the products available, but also having programs so that patients can actually use these products. So across the region, we have over 30 access programs that cover more than 15,000 patients in getting access to these medicines for rare disease, inflammation and immunology, and oncology field. And it varies a little bit country by country, but I'll use Egypt as an example. We have over 6,000 patients currently enrolled in these types of programs in Egypt. In the same vein, we also launched an app called Ayudu, and I know everybody has an app, but I think we feel this really is an innovative app because it helps healthcare practitioners and patients with affordability programs in a digital manner. So it makes it much faster for patients to get access to these breakthroughs that can change their lives. If you have to wait for months to get an approval for an affordability program, if you're suffering from breast cancer or colon cancer, that's not the way you want to work, right? So this will really help patients get access to these medicines much more quickly than was previously possible. And I'm very proud that this is a program that really started here in the region, so it's available in Egypt, Qatar, and Lebanon. It's now being expanded to markets like Brazil and other countries in Asia Pacific, just to show you how the innovation also can come from this part of the world to help our patients get access to these breakthroughs. So I'll talk a little bit more about a couple of these partnerships that we have in the region. I think in 2023, we solidified our position as really a trusted partner in the MERA region, collaborating with governments, healthcare professionals, but also patient associations. We have a lot of different partnerships and signed a couple of new ones even last week that we'll talk about in a little bit. But I want to highlight a few. The one I would like to highlight for the Egypt-Levant region is our collaboration in Egypt with Hayek Arima, a presidential initiative sponsored and initiated by President El-Sisi. When you look at the empowerment of underprivileged citizens in Egypt. So Hayek Arima builds infrastructure and provides services to over 4,500 villages that really did not have access to healthcare, for example, before. In stage 1, phase 1 of the agreement that we had with Hayek Arima, we were focused from the Pfizer side really to provide education to all the healthcare practitioners and first aid providers to really help them provide medical services in these 4,500 villages. I'll talk a little bit more about phase 2 in a minute of that. In Morocco, we recently signed. I was in Morocco in Rabat a few months ago. We signed 2 memorandums of understanding with the Moroccan government. One more focused on infrastructure when it comes to universal healthcare, helping patients find the pathway in a universal healthcare model. But the second agreement that we had was in the field of antimicrobial research, or AMR as it is mentioned here. Antimicrobial resistance is one of the biggest threats to humanity when you look at the abuse and misuse of antibiotics, but also the emergence of super viruses and super bacteria. So we're working together with the Moroccan government to establish a local surveillance system to track really where resistance may be popping up, where the switch to other antimicrobials needs to come in, and what really the risk is to the Moroccan population. So we're very proud of that collaboration in Morocco. In Kazakhstan, I was there in November, and we signed a contract with SK Pharmacy, government-supported pharmacy system to supply locally our pneumococcal 20 PCV, pneumococcal conjugate vaccine to the country for 10 years. So I think it demonstrates our commitment to national immunization programs and really working with governments also in middle-income countries and low-income countries to make our products available to their citizens. In the UAE, we have a lot of different collaborations, but I think one that I would like to highlight that I think is very much aligned with the government's focus here to become really a hub for knowledge and a hub for innovation and science, is the collaboration we have with the Dubai Academic Health Corporation and AXDEF Global. And what are we doing there? We're looking at how care for patients with chronic conditions can be improved. And initially we were looking at diabetes, not an area where we ourselves are active, but we're working with the scientists of these different groups, with our scientists, to develop really a tracking and a model that will help governments be better prepared to manage these types of conditions. And the interesting thing is that's not something just for the UAE, it will be rolled out further now in North Africa and Asia Pacific. So I think it kind of shows our alignment with government priorities when it comes to also being a center and a hub for knowledge and innovation. Moving to South Africa, I think this is a project that any of our colleagues that either work in South Africa or have been to South Africa feel very passionate about. It's a very different kind of example. In South Africa, you have the Unjani clinics, and the Unjani clinics provide healthcare through a nurse-operated model. There's initial funding to basically fund a container-sized healthcare unit for underserved communities, both in cities as well as outside of the major cities, but really owned and operated by these nurse practitioners. And what that does, it creates really a sustainable model that is only initially dependent on the pre-funding, but then the nurse practitioners themselves become responsible to really drive this further. So we have been working with Linda and the group in South Africa for a number of years now. We had funded already a number of different clinics. We provided technology for over 60 clinics further. Last year when I was there, we signed an additional agreement to fund another 9 clinics in South Africa to provide primary health care to the people that need it most in South Africa. All right, so when you look at everything that we've done last year and over the years in the past, it's only possible because of our amazing team and our amazing colleagues like Lamia, like Omnia standing in the back there, but all our colleagues in all our different departments that really are clear also about what it is that Pfizer wants to achieve. And in order also to make sure that we develop our colleagues properly, we've been very much focused on building a more inclusive colleague experience. When I arrived in the region, and you looked at the way that the balance between male and female colleagues was, it was a 60-40 male-female split. I just told you now that 4 years later, we're at 57% female colleagues, 43% male colleagues in the organization. But you also need to develop the female colleagues that come in so that you build a bench strength also for leadership in the organization. So there we have our Leadership Aspiring Future Talents in AFME that we started in 2019-2020. To this date, we've enrolled and pulled through more than 140 colleagues through this program, and more than 2/3 of them, since completing the training in the LAFTA program, have moved on to promotions and different roles in the organization. So we're very serious about making sure that the right talent moves forward in the organization, not based on the number of years they have in the company, but on their potential and future abilities for the organization. Aside from that, we have a number of other programs. So we're also started in South Africa a couple of years ago, a whatever